Hi there, my name is Jasmine.
I'm Sonia. And I'm Diana.
We are LPN second year students, and today we are going to reflect on the postpartum care simulation. Talking about my feelings during the sim, I was feeling less nervous because our group was group number three. I believe I learned a lot from the other groups. In addition, I was the documenter, so I felt like I was not under that much pressure as the other team members who were primary nurses and actually with the patient. However, I provided support to the team, reminded them if they were missing something. Overall, I was confident with my team and myself. In future, this experience will help me to remain calm and help my teammates during pressurized situations.
Although we were the third group, it's always a different feeling watching from the debrief room than being the nurse in the simulation room. For me, I wasn't really nervous because we watched others before us and noted areas to improve on, which helped build a certain confidence in performing the Bobby assessment and providing timely intervention for the noticed abnormality in the funders. In the future, just like we did during the simulation, I will prioritize present concern before checking all the boxes outlined on an assessment list. For example, during the sim, we moved to checking and massaging the fundus after noticing a decline in blood pressure and observing a saturated pad, rather than listening for bowel sounds before palpating the abdomen. Even though it's not my first simulation, I still felt nervous, especially when trying to remember the steps and response correctly. And as the simulation goes, I became more focused and pay attention closely to the patient's concern and my team members. This experience helped me recognize my areas for improvement, which is the communication, critical thinking skills, and doing a good assessment. It made me realize I need this experience to grow as a nursing student and become more confident as it will help me prepare to become a caring and competent nurse in the future.
Talking about the group dynamics, I believe we did a good job as everyone was communicating clearly and were listening to each other to bring best patient centered care.
The strengths we bring to our team are one, clear communication with patient and team members. For example, for the patient care, we provided education to the patient, such as how to do pericare and use a peri bottle. We also provided her with emotional support by reassuring her and providing resources and referrals. Also, clear communication was established between team members, shown by mutual decision making. Um, Second strength is we use evidence-based interventions during patient care. For example, when we saw that the blood pressure is low, we proceeded to the fundal massage and checking the fundal tone to prevent postpartum hemorrhage as evidenced by research.
The third strength, I would say, we set priorities and used our critical thinking skills during process. For example, we prioritize fundal massage and prevention of postpartum hemorrhage then rather than following the bubbly assessment.
Another strength was appropriate assessment for postpartum care. For example, we did body assessment and vitals, which is appropriate for postpartum patients. Lastly, we also demonstrated teamwork and collaboration by assigning roles to each other and following them throughout the simulation. We relied on each other's assessment and checking in within each other if all of the priority assessment were done. For example, reminding each other to take the blood pressure after doing fundal massage.
Moving towards the areas of growth, we could have established clearer communication between team and patient. For example, by speaking louder, letting a person finish their sentence first, considering patient's concern while talking to each other and answer them. Because during the simulation, due to nervousness and given situation, we were talking at the same time. It can be improved if we talk and wait for the other persons to respond, including patient and the team, to address their concerns or need.
We would not say that we made any incorrect decisions which would have harmed the patient in any way. However, there are some areas to improve. such as clearer communication, more engagement with the patient, and better teamwork. For the future practice, we will make sure that the decisions are patient centered and evidence based to prevent any incorrect decision making.
For our key takeaways, the first one would be critical thinking and prioritization. For example, we switch from bubbly checklists straight to checking the tone of uterus and fundal massage when we saw that the blood pressure is low. Therefore, we use critical thinking skills and prioritize reproductive assessment to prevent complication. However, we went back to bubbly assessment once the concern is addressed and solved.
Another takeaway would be clear communication between the patient and team brings patient centered care and best outcomes for the patient. Although we were lacking some communication, we still did good job as we were listening to each other's concerns because we were focused on patient and her needs rather than conflicting with each other to bring out best patient outcomes.
Overall, our care today was patient centered and we learned a lot that we will take with us into our future practice as nurses. Thank you
Thank
very
you.
much for
Thank you.
listening to us. Thank you. Bye bye.